PIO to Belize for 4 years. And although it may sound hokey, it was life-changing for me. I think that it's one of the most beneficial educational experiences that we offer. The students learn an amazing amount about medical care, about taking care of patients, but also about medical systems and about government systems that have to do with medicine. Every year that I've gone, I've just been amazed at the organizational skills of the students, about their ability to contact the government agencies, to get a hold of pharmacies, to arrange for medications. And that's an amazing introduction into all the facets of medical care that patients have. It makes a tremendous impact on the patients. For you, me, it's easy to go across the street and buy some ibuprofen. If I have a headache or when my kid's sick, I just bring them in. For them, if their child is sick, it's an hour walk to a bus, and then a 2 or 3 hour ride on a bus, and then a wait, and then the same process repeated. Many of them are barefoot or in tennis shoes or flip-flops.
Downsides of doing a mission trip like we have in the past is that, yes, we're going to rural areas that they never see physicians unless groups like us come to see, but also it's difficult to follow up and to track those patients. And I think now we're going to an established clinic, so they're still needy of our care because really they don't have any resident physicians or nurses or anything like that, but it'll give us the opportunity to follow up with those patients in the past. And so I've described it to other students by saying, it's similar to JDoc in that we're treating acute patients, but we're also adding like a diabetes night or a hypertension night where we can follow them long term rather than just kind of shipping them.
Now, seeing that come to life and sitting here thinking, in less than a year from now, right where I'm sitting, there could be somebody sitting here getting the treatment they need just to live.
This trip accomplishes 3 major goals. The first being that as students we get an amazing opportunity that we wouldn't get anywhere else. And the second being for the people of Guatemala, we get to provide a healthcare service that they would otherwise not be getting. And it's a sustainable healthcare service. The third being that we get to represent KU within our community as well as internationally.
There's one more time.
One more time. What do you say? Rock chalk.
Rock chalk. All right.
One more time.
Rock chalk.
Show how you brush your teeth. Show them. Yeah, perfect.
My medical school experience because I think it's a good learning process. I mean, a lot of students do volunteer activities like JDoc or go visit their preceptor in order to get more experience working with patients and seeing different types of diseases. So I think it's really a good experience to practice your clinical skills and interviewing skills, but also to see a lot of different diseases, like in some of the infectious diseases and and different presentations of diseases that you would not normally see in the United States.
And now that we've partnered with Heart to Heart, we're going to have sustainability with these trips for years to come, and the patients can get the continued care that they need. So thank you so much for coming to our auctions and for all of your generous donations. These trips couldn't be possible without you or the other donors that have contributed.